Hi, everyone. Good evening. Hi, everyone. Welcome to this case presentation video. Today, I'd like to share a case that I treated with Invisalign and dental monitoring, extraction case. 4 premolars were extracted, and how we managed to do this case while the patient was overseas and could only visit Australia every few months, like every 9 to 12 months, and how we still continue to check the patient in retention using dental monitoring app. So give me 1 second. I'd love to start to share this with you. So guys, so this case report was actually published in Seminars in Orthodontics, one of the recent editions on artificial intelligence and digital orthodontics. And this is a paper that I've written with several other authors. And the case that I treated was featured in this paper. So if you have a moment, make sure you download it. It's Seminars in Orthodontics 2021. And it's really highlighting how artificial intelligence-driven systems like dental monitoring can help our clear aligner treatments. So this is one of our patients in Sydney who then had to travel to the UK, and we kind of had about a 3-year treatment plan, and she had never felt confident to start treatment anywhere because of this travel needs and having treatment done across multiple locations. However, we knew that using aligners and dental monitoring, that we could provide her an orthodontics to suit her lifestyle, continue to monitor her from overseas, even courier or ship packages overseas for her, monitor her gingival health, and many other dental parameters. So this is a patient at initial presentation. She's an adult patient who came with moderate to severe crowding and moderate anterior open bite and gingival display on smiling. So as you know, for those who do a lot of orthodontics, generally for someone like this, we would be thinking more surgical route. We'd be going orthognathic surgery with or without extractions, because we have this bimaxillary dental alveolar protrusion. How you can see her upper and lower lips seem pretty protrusive, almost a bit strained and incompetent. And that's all because of the resultant vertical nature of her bite that is quite open anteriorly. So here we have her at the start, and we discussed obviously several options, and orthognathic surgery wasn't one of them. We did discuss mini screw assisted clear aligner treatments as well, which many people would probably start her from day one with mini screws, and I don't really like to go that way. Because aligners are pretty good at controlling the vertical dimension. And in this case, we leaned towards extraction to relieve the crowding, to close the open bite using the drawbridge effect that happens when you actually retract incisors. But the key here was, which the patient knew, was that if we did that, we would possibly increase her gingival display on smiling. And she took that on board. And what you see at the end, we actually didn't increase it that much, but you will see at the end how well this case has gone. So we decided on 4 premolar extractions. From memory, I think they were her upper second premolars and lower second premolars. We decided on clear aligners, so that we had very little need for emergencies during all her travels. We were able to ship aligners to her if need be. We decided to start her on dental monitoring, go live weekly protocol. So we would be virtually tracking her aligner fit, all her attachments, the progress of her space closure, all of that, while she lives in the UK, yet able to travel to Australia at least once a year. So this is an initial OPG. You can see the impacted third molars that need to be removed. However, there wasn't an urgency for this because we're not distalizing any of our arches. So we were happy to leave them aside and deal with them as needed and possibly post-treatment. Overall, she had good general dental health, nice alveolar bone heights. There were no periodontal pockets that significant enough that we worried about doing orthodontics. And this is a little snippet of showing you how we extract this. Around 2018 is when she started treatment. You can see we extracted, or the dentist extracted the second premolars in every quadrant. And what you're seeing here is her progress through it all, okay? So these are views taken from dental monitoring. So let's start with the very first treatment plan we created. So the very first plan that we created was to basically retract her incisors. And how were we going to retract those incisors and close the open bite and relieve the crowding? Well, we were going to extract her second premolars. So the extraction obviously happens quite early on in treatment, usually at the start of treatment. You have pontics that can be placed in clear aligners, and you'll see them more in the side view. You see these pontics coming on now where the premolars are their gray teeth, and these pontics can be painted to look like natural teeth. So most of the time when the patient's wearing aligners, it doesn't affect their aesthetics. Now we decided on a type of horizontal elastics to retract her incisors. So we're looking at elastics that went from her upper canine to upper first molar and lower canine to lower first molar on each side, because this is a case where you want to retract everything equally on each side. There was no midline shifts, not significant enough. And you can see a lot of incisor retraction with very little posterior mesialization. Now, another thing aligners are very good at is pushing. So they're very good at incisor retraction. And as you retract incisors, you will obviously close bite. Here's an occlusal view of her initial plan. Now, one tip I'm going to give you is please never be afraid of the number of aligners. People get often scared by it. I just think it's not necessary because you often have to revise as you go along. So here we have incisor retraction in the occlusal view, some expansion, which is within biological limits. And you're seeing the occlusal contacts at the end that are built up so that we have no posterior open bite when we finish. Again, this is very critical in aligner treatments. You must have some sort of posterior extrusion, especially in lower and upper arches, even in open bite cases, to end up with some sort of occlusion at the end without a posterior open bite. So the patient is 5 months in progress and everything is going really well. What you see here is the fact that the premolars are literally walking, okay? They're not actually dumping. We haven't had any anchorage loss here. So 5 months in treatment, we decide to do a revision and get her some more aligners made up. And perhaps to even spin, you see the step between the 1-1 and 2-1, her upper centrals, possibly to alleviate that as well. What we also are seeing here at that time point is how good the anchorage control is. You see the incisors retracting, the open bite closing. You also see how we're retracting a tooth at a time, and there's very little tipping or anchorage loss, and they're moving bodily. Now, how are we able to get such good tooth movement and space closure in an extraction case with aligners? Well, the key here is to use dental monitoring. Why? Because what you're seeing on the top is green and red. So when the patient submits their scans on a weekly basis, we tell the patient whether they're ready to change the aligner or not. Now, it is semi-automated. However, the doctor can override any decision. So we were able to tell her at times when she was very compliant that green, go change to aligner number 2. But when it was a red, that means she could not move forward and she had to stay in the current aligner. And what you're seeing here is that week by week, we were able to virtually monitor and deliver the right messages to her. So it doesn't take a lot of common sense to know that this kind of system would be more dynamic and would be able to constantly refine the patient's treatment and troubleshoot early. And hence we should get a much more predictable result and an efficient result, which you kind of see here. You see how there's not a lot of dumping of your molars. what we're seeing, though, posterior open bite developing slightly. Okay, so that shows we had to extrude a bit more. So at the first revision, we didn't change any attachments because we weren't able to see her in Sydney. So we decided to keep the same attachments and the same buttons and continue with the same plan, space closure. What you see here, we're trying to extrude the upper right central, so her 1-1. And of course, there's no attachment on it. So we know extrusions aren't very predictable without attachments. So you will see that that is a tooth that we had to bring her and put a new attachment on. So again, we're seeing a side view. We continue our incisor retraction, 5 months in treatment. We're getting some more aligners made up for the patient. And we're retracting a tooth at a time until the canines are retracted, and then we retract the incisors en masse. So we're subdividing our active tooth movement to control our anchorage a lot better. These are simple anchorage principles that rely on tooth surface area being employed. So now we're 13 months in progress. You can see the uneven gingival display on smiling, yet it hasn't seemed to have increased. We still have this biomaxillary dentoalveolar protrusion. We still have slightly protrusive lips, but we know that overall we're heading in the right direction. We do have retraction of those incisors, open bite closure. Our midlines are fairly coincident, and we don't have any significant dumping of any of the tooth or tipping. By dumping, I mean tipping of teeth around the extracted space. So we're seeing a really, really nice space closure. Again, if you look at the molars, you will see that mild posterior open bite developing. Now, there are some worn restorations occlusally that have contributed to this. But what we started to notice is that there was significant movement built on the upper left canine, which is the 1-3. And initially, we didn't have an attachment on it. We simply had a button. So to actually get that kind of movement, we lost traction in the aligner. So that loss of traction meant that now we need to bring the patient in, revise our plan, and perhaps rather than waiting to actually troubleshoot early, put an attachment and let's get going with the plan. So here you have the 2-3 that has lost, that never had an attachment place. So this is a great doctor learning portal as well. So we're back on track. We're able to see the patient in Sydney from UK. We were now able to place 2 new attachments that were needed, especially on the upper central, which we're extruding, and the upper left canine, which had traction failure. So the patient is now 13 months in treatment. This is revision number 2. We are getting excellent space closure, no tipping or anchorage loss. This is a incisor retraction case, which aligners are very good at. We've got good control of the vertical. We're closing that open bite really nicely, and we don't need any mini screws to do so, okay? Now, you would say, what about that gingival display on smiling? And we're gonna get to that in the end, because initially she had uneven gingival display on smiling. Although it was increased, it was uneven. And I always believe beauty is in symmetry. You know, a lot of our research papers show when things are symmetrical, they tend to appear more beautiful. So when you are able to extrude all the incisors and level those gingival heights, you tend to, even though with increased gingival display, you tend to get a much more attractive smile than you would when they are they got height discrepancy, especially in the gingival zeniths. So we're 28 months in progress. Now here we're evaluating the patient across the world from Australia, and the most recent pictures on the right, and you can see the changes, and the patient's about to fly to Australia from the UK. And around 28 months, we were able to look at various angles with aligners, without aligners, and really know that this case is going very well, and that when she comes, that we are able to, with quite good certainty, I'm able to tell the patient that we'll be finishing the treatment, or removing all attachments, all buttons. We don't have any further need of elastics. And you can see that from multiple views that she took. It's absolutely imperative you teach your patients how to take dental monitoring scans really well, and that they're able to really send you views, such good views like this. So we look at the before and we look at the 28-month progress, and we're very happy with what's going on, the gingival health, the gingival height, the space closure, the anterior open bite closure. And you can see this is how the patient does their virtual appointments. They're simply using a retractor, just pulling them and taking a video with aligners, without aligners, with teeth together and teeth apart. It takes most adult patients 2 to 3 minutes to upload these on a weekly basis. And we've often noticed a higher compliance when we give them dental monitoring with their aligners. So here is our lovely patient who comes at the end of a treatment. We are pretty certain that we are finishing this case on this day. We again have a mild posterior open bite, but as I said, there's an occlusal restoration on that tooth that perhaps affects it somewhat as well, and worn cusps. However, we really don't need any further revisions. So we had a 4 premolar extraction case. We used Invisalign. We used dental monitoring Go Live. We were able to coordinate appointments and aligners between 2 countries, and we were able to finish the treatment in a relatively good time. This is her final cephalometric X-ray taken on her last visit. And you can also see, so the incisor angulation is pretty good. We've got a positive overbite. And although there's some mild lip incompetency, that's from the lip thickness. Often that comes from your lip tonicity, lip thickness, lip length. We still have that, but the patient did not want surgery. So we're not able to correct everything unless surgery was done. We still have those impacted third molars. They haven't caused any grief during treatment, but now I think it's time to extract them. We can start to see the lower right second molar and the lower left second molar now starting to possibly have some distal food impaction, and it would be the right time to extract the third molars. So the patient's final panoramic X-ray shows good root parallelism, a nice finish, no open contacts, no spaces, no significant bone loss, very similar to pre-treatment, and we're pretty happy with the result. So here's the initial photos, and there's the final photos. And you can see, although gingival display on smiling remained the same, it started to look more symmetrical and even. But not only we use dental monitoring during active treatment, we now continue to monitor stability of the result with dental monitoring. And now we ask the patients to do scans on a monthly or bi-monthly basis, where the patient will now submit views with teeth together and teeth apart. So we are able to compare from our scan taken on the day of the finish. So we've got a STL file of the patient's finished result. And these are taken from a 3D scanner. And we're able to now compare month by month if any tooth has moved. And if a tooth movement occurs, we can catch it fairly early and ask the patient to wear the retainers a lot more than before. So this is what I believe a very smart system of treatment. And I've written a lot of articles and blogs about clear aligner mechanics and how to best maximize their artificial intelligence and technologies. So make sure you end up on this website, digitalorthodontic.college.com/blog, and subscribe to it, because I'm sure you're going to love the engaging content I've created. And finally, I'm very proud to say that we have, over hundreds of dental practitioners across the globe who are enrolled in our Australian and UK-accredited diploma. So if you want to know more about it and how to treat cases predictably, safely, and efficiently with clear aligners, please contact us, digitalorthodontic.college.com. Thank you very much. I look forward to one day meeting with you and seeing you. And I'm very, very glad that you heard me today, that you gave me the time. If you have any questions, please use the comment below on this video. Feel free to ask me questions or go on our website, register digitalorthodontic.college.com, and I'd be really happy to answer questions about these cases. Don't forget, Seminar in Orthodontics, April 2021 edition also has this case in the paper. So thank you very much for watching. I look forward to speaking with you all one day. Bye.